Hi dear colleagues, this is Dr. Azar, and in this video I am going to present tooth number 23 preparation for PFM based on Australian Dental Council criteria. Fast and quick, I start with the incisor reduction. According to ADC, an incisor reduction which has sufficient depth for a PFM crown and comes under satisfactory subgroup is between 2 to 3 mm. Less than 2 mm, even 1.99 is inadequate because porcelain won't have enough thickness and will chip off, or the crown will have high spots in occlusion and it compromises final crown. So any reduction less than 2 mm is an absolute fail in occlusal reduction category, and we aim to go for 2.2 to 2.5 mm occlusal or incisal reduction. Among the burrs we have in the exam, cylindric flat end burr which has 1 mm diameter is what we need to prep 3 separate grooves on the incisal edge, each one with 1 mm depth. Then we start to remove the islands in between the grooves. Pay attention to the burr angulation. If you move it parallel to the grooves, the existing grooves, it falls in the depth of them and deepens them more than 1 mm. But if you move the burr with oblique motions, this won't happen. So as you see in the video, the burr is held totally oblique to the existing grooves, and this way it won't fall into the grooves to deepen them more than 1 mm. Then prep the second 1 mm groove on the incisal edge and remove the islands in between. Now the incisal edge has 2 mm depth, and you can quickly check it with the index putty you made before the start of the preparation. From now on, remember that one way to control your burr movements is to have a secure finger rest. This way, inadvertent prepping and damage to the adjacent teeth would be minimized. Now we move to the buccal surface. In the ADC guideline, what seems incorrect is that 1.2 mm reduction on the buccal surface is considered as very good, but at the same time, 1 to 1.8 mm reduction is satisfactory, so it is a little ambiguous. But what is for sure is a fail is inadequate reduction of tooth structure, as in the lab, the porcelain layer would be formed over contour. So in the exam, we aim for 1.5 to 1.8 millimeter rather than less. Because as you see, inadequate reduction that compromises final crown comes as borderline or unsatisfactory. Again, we prep 3 1 millimeter grooves, 1 in the middle and 2 on each sides, with 1 millimeter fissure burr, and then connecting the grooves with the same burr. Notice that because the burr is 1 millimeter, you can make sure about the depth by stopping preparing and check if the burr is inside the groove totally. It shows that you have already made a 1 millimeter depth groove on the buccal surface. While you are removing the islands, don't hold the burr parallel to the grooves and hold it obliquely. Otherwise, it falls inside the existing grooves and deepens them more than desired. As you can see, the buccal surface is divided into two sections. 2/3 of it is the actual buccal surface, which we prepare it first, right now, as you can see. And the second is the cervical part, which is prepared after this surface. Pay attention to the motion burr to smoothen the islands between the grooves. Certainly for preparing this part you have direct vision and there is no worries about it. And still we haven't changed our burr and we are still using the fissure cylindric 1 millimeter burr. The third step is the cervical margin. This area is a critical area because it is going to be assessed in 3 separate criteria. First is the margin position. The ideal position is 0.5 millimeter supragingival, but any preparation under 1 millimeter or equigingival is satisfactory. Pay attention that if you choose to prep 0.5 millimeter supragingival, it should be the same throughout your preparation. I mean that it cannot be equigingival in one area and 0.5 millimeter supragingival in another. The next one is the margin width. The minimum desired margin width is 1.2 millimeter, but consider that even 1.19 is inadequate. Because to gain enough porcelain thickness, the technician over-contours it to gain enough porcelain thickness, and it causes an undercut, which is a good place for bacteria and gingivitis. So aim for 1.3 to 1.5 millimeter, which is safe and satisfactory. On the lingual margin, 0.5 millimeter is risky because the temporary restoration will become so fragile on this area. So we aim for 0.7 to 0.9 millimeter on lingual area. The next part is margin form. It should be smooth and continuous and identifiable in all areas. Consider that only one area of roughness is in satisfactory group. So for the margin area, take as much time and attention possible to prep the area. You have 3 options and you need to see which one you are most comfortable with. First, you can prep 3 1 millimeter grooves with flat and fissure burr on the center and 2 on the sides, and then connect them together with the 1 millimeter fissure burr. Or you can prep the marginal area with sweeping motions with 1 millimeter fissure burr without drilling any groove in the beginning. Or you can prep a 1 millimeter supragingival groove with the round burr you have, then change the burr to the flat and fissure 1 millimeter burr to prep the rest of the cervical area above the existing groove you made. I prefer sweeping motions and I started almost 1 millimeter supragingival. Try to have good control on the burr motions, and you can turn mannequin's head up to 20 degrees towards right side if you are right-handed, and sit at 12 o'clock to have proper direct vision. After finishing the first go, measure the margin distance to the gingiva and try to reduce it to less than 1 millimeter supragingival in this level. What I want you to be aware of is the light movements of the burr without any force and pressure. Otherwise, the burr carves into the tooth structure unwantedly. Now it is time for the proximals. The burr we need is the flat and tapered 173, which is 0.5 millimeter in the tip and 1.2 millimeter at the end. It's better to use a separator or wedget to prevent damage to the adjacent tooth, but consider that it changes the alignment of the canine tooth a little. So when you place it in the mesial side, it moves the canine to the distal, and when you put it in the distal, it moves it a little to the mesial. If you have a good control over the burr movements, you can do the proximals preparation even without a separator or wedget. Again, use sweeping motions from buccal to the lingual. As this burr is tapered, in this stage, hold the burr parallel to the tooth line axis without any tilting it to mesial or distal. The next step is the cingulum area, and we aim to prep between 1 to 1.5 millimeter because less than 1 millimeter results in a fragile temporary crown. We use a 1 millimeter round burr to prep grooves like the picture. You can find an area to hold your mirror almost outside the mouth with the least amount of water splashing on the mirror and good vision on the palatal surface at the same time. This groove can guide us well about the amount of preparation on the cingulum area. Then with the football-shaped burr, connect the islands in between, and this way you gain 1 millimeter depth of preparation on the cingulum area. The last step in the first row of preparation is the palatal margin. As we discussed earlier, we aim to reach 0.7 to 0.9 millimeter, and you can either use 173 burr tip, which is half a millimeter, or the flat end fissure. Again, you can cut fissures or use sweeping motions, but as the area is really small, having control over cutting 3 grooves is difficult, and it's better to use sweeping motions. After the first row of preparation finished, we have a rough idea of how the preparation looks like. Now we start using the putty index to exactly get to the desired dimensions. Again, we start from the incisal edge, and you see that it is 2 millimeter, and we want to reach to 2.2 to 2.5 millimeter. The best thing is to use 3M Suplex polishing discs, which are available in two sizes and different abrasiveness. It's better to use the dark orange disc or the light one, and be careful not to damage the adjacent teeth. As these discs are used in low-speed handpiece, you have better control over them, and at the same time there is no water splashing, so you have better vision too. Now on the buccal surface again, we use the putty index to check the needed adjustments. Here you see that the buccal-incisal margin is both sharp and under prep, and we wanted to reach to 1.5 to 1.8 millimeter on this surface. And also the marginal prep is under 1 millimeter. And as we are doing the final adjustments, we aim to reach to 1.3 to 1.5 millimeter. Okay, what we have to make sure about confirming the depth of preparation in the critical marginal area. Either use your putty index and the probe you have, and exactly when the first black line finishes, you have 1.2 millimeter preparation depth. Or use the cylindrical flat end round edge burr you have in the exam. It is 1.2 millimeter and you can put it on the margin you prepped and see if it is totally within the marginal prep. Here, as you see, I am using the flat end fissure cylindrical to get to the desired depth in the marginal area with the sweeping motions. And when you want to check the depth of preparation with the flat end round edge burr you have, you need to insert it inside the high-speed handpiece you have. And when you see that the burr is totally within or inside this area, you can make sure that you have prepped 1.2 millimeter in the marginal area. But as I mentioned before, to be in the safe side, it's better to increase the depth to at least 1.3 millimeter. Another useful hand instrument we have is Hatchet. It helps you to remove enamel lips because if you use the radial shoulder burr, it may produce some enamel lips. Or you can use it in the proximals to remove some minor roughnesses. You need to have a good hand rest to have better control over the cutting edge of the hatchet. If you have a stable finger rest, you can exert sufficient force on the cutting edge of the hatchet and carve the irregularities better.
In this step, be cautious about undercuts. ADC says minor undercuts even on one area is satisfactory. So pay attention first that it says minor and second it says on one surface of preparation. Undercuts happen when you do not hold the burr parallel to the line axis of the tooth in the marginal area, and when you hold the hatchet next to the buccal height of contour, a triangle forms which shows an undercut. You can fix it with controlled burr movements and correct burr alignment. It is better to press the pedal and release it, and when the burr speed is reducing, prep the area or adjust the burr speed to have better control, or use discs for removing the undercut.
Now back to the proximals, we want to fix path of insertion, overall taper, and line angles. You know that the definition of path of insertion is an imaginary line along which the restoration will be placed or removed from the preparation. If it leans towards mesial or distal, when you want to place or remove the crown, you should do some adjustments in the adjacent teeth. So even under the satisfactory subgroup, you see that it says the path of insertion should be in a way that does not require any modification of the adjacent teeth. What dictates path of insertion is the taper of two opposite walls like mesial and distal walls. If you increase the taper of, for example, mesial wall, the crown path of insertion is towards distal. So if you evenly distribute the taper degree on the opposite walls, the path of insertion would be straight and occlusally. I mean parallel to the line axis of the tooth. So we aim to gain 12 to 15 degree of overall taper, which means 6 to 8 degrees on each wall. And last but not the least is the well-rounded line angles. It is not something hard to do, so we certainly do it very well to get the full score. Pay attention to look carefully on your preparation from different angles and inspect any problem. As you see in these two areas, there are steps. It is where the palatal margin reaches the mesial and distal sides. And these transition angles are the areas that become under or over prepped or steps happen there. So with 173 burr, you start to both adjust the taper degree and level the steps, and when the pathway from buccal to palatal is smooth with this burr and it is well fixed, use parallel fissure burr to increase the depth in the proximals to 1.3 millimeter and reduce it to 0.7 to 0.9 millimeter towards palatal margin in a way that fissure burr passes easily from buccal to palatal. For final adjustments of the palatal surface, we have pointed enhanced point and the slow speed round burr, which is size 6 or size 4. Most of the time, the junction between the cingulum area and the axial wall is under-prepped, and you can fix it with a slow speed round burr to reach to 1 millimeter or even a little more. And the pointed enhanced burr is ideal for the cingulum area. You can even create palatal depressions on the cingulum area. And as you remember, we prepped the cingulum area with round burr, high speed 1 millimeter. And during the final adjustment, if we increase it up to 1.2 millimeter, there is no worries. Also, with the enhanced points and the discs you have, the line angles should be well rounded. Actually, sharp. Again, we use the putty index we have to get to the desired dimensions and fix every dimension into ideal. This enhanced point is really useful. You can use it to remove the sharp line angles, and with a little more pressing it, you can even increase the depth of your preparation.
Okay, we got to the end. We need to learn how to self-assess our preparations. It happens when your eyes get used to what a perfect preparation looks like and compares ours to it. It happens gradually and after a number of preparations. So in the beginning of your practice, remove the mannequin's jaw and look carefully to find flaws, and then replace the jaw and look at that specific flaw inside the mouth to teach your eyes to find the problems while you are in the exam. Learn how a well-tapered preparation looks like and search for the presence of undercuts by drawing a fine line in the internal marginal line angle and see if you can see it. See this line circumferentially in the mirror. Otherwise, be aware that there is an undercut. Well, dear colleagues, thank you for your time. I know that you have questions to ask. We are available on the provided accounts. Look forward to our next videos. Certainly there are many more details and tricks to know. Pay attention that before setting for this exam, you need to know each and every possible thing to avoid and prevent dealing with unknowns on the exam day.